Hello radiographers, welcome to my channel Radiographer Zone. Today I am going to discuss about X-ray of esophagus, contrast X-ray of esophagus, barium swallow, how to do it. So let's start. A barium swallow test is a special type of imaging test that uses barium and X-rays to create images of your upper gastrointestinal tract that includes mouth and pharynx and your esophagus. So it's a contrast X-ray of esophagus that uses a contrast medium. The anatomy is here. So start from mouth and it ends to the stomach or gastroesophageal junction. What are the indication? Dysphagia due to cancer, stricture or varices, hiatus hernia, esophageal reflux disease, suspected foreign body, blood with vomiting, unexplained weight loss, and esophageal ulcer or polyp. What are the contraindications? Recent esophageal or gastric surgery, suspected perforation, tracheoesophageal fistula, complete bowel obstruction. The contraindication means that in which cases that this test is not allowed or it will be complicated. The equipments. What are the equipments needed? Fluoroscopy unit, tilting table, and obviously the contrast. Barium sulfate powder is the contrast. Mug, spoon for making paste, water that will be mixed with barium sulfate powder, and gas producing agent if double contrast is advised. Contrast media type and dose. So barium sulfate powder is an insoluble powder that is not soluble in water. So in our country we use Bugat powder of 150 gram, and if needed sometimes we use air for double contrast and a specific tablet that produces air or gas is used. So why barium sulfate is used? Because of it has excellent coating of mucosa, lack of absorption in the gut, lack of toxicity, radiopaque material, and it's water insoluble, and it has high density, and it provides a positive contrast X-ray. What are the patient preparation? Ask the patient not to eat or drink before the procedure at least 2 hours, and to psychologically prepare the patient, explain the procedure to patient, how and what is going on and what will happen during the exam, and remove the clothing and wear hospital gown to the patient. So let's go to filming. At first take non-contrast X-rays of anteroposterior view of esophagus and then lateral esophagus. That's are plain X-rays, and it's necessary for point of reference and for the selection of exposure factor. And the technique is place the patient in the erect upright position and then make a paste of barium sulfate mixing with water and give 2 to 3 spoons of mouthful of barium sulfate paste into patient's mouth and ask to hold it and go to the fluoroscopy monitor and ask the patient to take several swallows of barium sulfate suspension and observe the phases of barium in fluoroscopy monitor and take images of esophagus to stomach, and the view will be anterior, posterior, lateral and left posterior oblique. The double contrast study technique is patient in upright position, injection buscopan is injected to vein, and gas producing tablet Calbucy is given with barium sulfate to the patient mouth. The patient should not barf after swallowing the barium. Then patient is asked to take several swallows of barium sulfate suspension. Observe the passage of barium in fluoroscopy monitor and take images of esophagus to stomach and take spot film in anterior, posterior, lateral and left posterior oblique position. So here is a double contrast barium swallow images. The black areas are the gases and the white areas are the barium sulfate. And this is not a normal esophagus. There are some pathologies here. And here the left main bronchus is compressed. And this is another example of double contrast. And this area is filled with gas and the white area is the barium sulfate. So the films are anterior posterior esophagus. This is an anterior posterior view and this is the lateral view. And this is another anterior posterior view and this is the left posterior oblique view of the esophagus. So observe the fluoroscopy monitor and when you get such images then take the X-ray. This is another images of barium swallow. That's the esophagus filled with barium sulfate. This is the esophageal junction here. And the barium sulfate goes to stomach. And there the thoracic vertebra. And this is a right anterior oblique view. This is the thoracic vertebra. This is the heart. So what are the complications will be arise after the study? Aspiration may arise, leakage of barium from unsuspected perforation, and constipation may happen. So there may be any fistula between trachea and esophagus. Then the barium will pass through the tract and goes to lungs, and it will cause the breathlessness and difficulty breathing. That is called aspiration. So we will be very careful after giving the barium sulfate paste. After swallowing that, we will be very careful. So what are the aftercare? Tell the patient to drink lots of water so that the barium goes out of the body, and inform the patient about the chalky stool, and also tell the patient that her stool will be chalky or white, so nothing to worry.